Now let's continue our discussion of direct interventions in physical therapy. Thermal agents are used to change the physiology of an affected area. The therapist must understand physiological effects and clinical effects of all thermal modalities. For example, the inflammatory response, which is the body's automatic response to injury, can be altered by physical agents. These thermal agents can change tissue temperature and cause a change in blood flow. For example, it can lessen blood flow or increase blood flow, and can accelerate the healing process. Thermal agents come in three categories: superficial heat, deep heat, and cold therapy, or cryotherapy as it is called. Superficial heat is used to increase the cutaneous tissue temperature. With use of these agents, the heat only penetrates a few millimeters into the skin, hence the name superficial heat. Heating the cutaneous tissue can result in reduced pain, reduced muscle spasm, and allow for increased motion and promotion of healing. Examples of superficial heating modalities include moist hot packs, infrared therapy, use of paraffin wax, and hydrotherapy. Here you will see a brief discussion of hot packs, a superficial heating modality.
We wanted to show you the type of heating pads we use here at Iowa State University Physical Therapy and Sports Medicine. The unit you see here holds our heating pads. Other names you may hear for these specific heating pads are hydrocollator, which you see right here, or moist hot packs. As you can see, they are placed in water. The temperature of the water is approximately 160 degrees. The hot packs are made of a canvas material that has a silicone gel inside which retains the heat very well. To prepare the hot pack for a patient, you first place the pack inside a terry cloth cover and then add additional toweling for sanitary purposes and to adjust the temperature of the hot pack for the patient's comfort. After checking with the patient for any reasons where you may be concerned using the hot pack, such as any lack of skin sensation or any allergy to heat, the treatment time is approximately 15 to 20 minutes.
Here you will see application of paraffin wax, which is another superficial heating modality.
Okay. Alright, so we're going to go in real nice and slow, and we're not going to touch the sides or the bottom of the tank. Okay? Okay. And we're just going to kind of dive in. Great. And back out. Good. And we're just going to let this get a nice dull color before we take another dip. So I'm just going to make sure that there aren't any cracks or bubbles forming. Alright, so that looks nice, so we'll take another dip. Same thing. And then back out. And we'll have you turn your hand over. And we'll do another. Here's 3. Good. And 4th dip. And that feeling all right to you?
Yeah, it feels good.
Good.
After 6 applications of the paraffin wax, the patient's hand is wrapped in a towel and allowed to sit for approximately 20 minutes. This is another form of superficial heating treatment. Superficial heating modalities should never be used with an acute injury, meaning an injury that is less than 48 hours old. This is because it would aggravate the inflammatory process, causing increased swelling, pain, and discomfort. Deep heating modalities have the same effect as superficial heating modalities, except the heat penetrates much deeper into the tissue, a few centimeters versus a few millimeters for superficial agents. Examples include ultrasound and diathermy. Ultrasound is sound waves which penetrate the tissue and is the same technology that is used for imaging, but the intensity is different. Diathermy, which you see here in your slide, is an example of a deep heating modality, but in this case it uses electromagnetic energy to penetrate and heat the tissue. Here you will see a short demonstration of ultrasound, a deep heating treatment.
We're doing therapeutic ultrasound on an iliotibial band syndrome condition. Therapeutic ultrasound has been around for probably since the 20s or 30s. It's came from sonar technology that submarines use, actually. And what we're using it is to send sound waves down into the tissue, in this case the injured iliotibial band insertion. And what those sound waves do is they vibrate and they create friction, which has the effect of dilating the blood vessels deep down inside. And it creates a heating sensation, but it's a deep heating, so we're dilating that microcirculation and getting blood flow into hard-to-reach areas in order to accelerate the healing process. So it's not the same as putting a hot pack on it, because a hot pack only sends heat maybe a centimeter and mostly heats the skin. In this case, we're penetrating deep into the iliotibial band tendon.
The next thermal modality we will discuss is cold therapy or cryotherapy. Cold modalities are used for two purposes. One is for acute injuries, where the desired effect is to decrease blood flow and metabolism, which ultimately slows the inflammatory process, so less swelling occurs. So the goal here is edema reduction. The second purpose is for pain reduction, both for acute and chronic injuries. Examples of cold modalities include moist cold packs, ice massage, and cold whirlpool. Compression is often used in conjunction to help limit swelling. Here we will see an example of ice massage, a cryotherapy modality.
Ice massage. Performing an ice massage is an effective tactic to promote healing by decreasing pain and inflammation. This technique is proven to be more effective than the traditional ice pack, especially on uneven contours such as the elbow, wrist, knee, or ankle joints. Preparation. Take a paper or styrofoam cup and fill it 3/4 full of water. Place the cup upright in a safe location in your freezer. Wait several hours for it to freeze solid. You may want to make several ice cups for future use. Remove the frozen ice cup from the freezer and carefully tear away the top half of the cup to expose the ice. Grab 2 towels, then proceed to sit or lay in an appropriate position that allows you to easily reach the painful area. Place 1 towel underneath the area you are going to massage with the ice, then gently use your fingertips to specifically locate the tender area. Gently rub the exposed ice on the tender area for 6 to 8 minutes, intermittently using the second towel to wipe your skin dry every 30 to 45 seconds. As the ice cup melts, you may need to expose more ice by tearing away more of the paper or styrofoam.
Still other physical agents used in physical therapy include mechanical traction, hyperbaric oxygen therapy, biofeedback, laser, and ultraviolet. These all have various applications, and you will learn more about them in the program. Examples include laser and mechanical traction as depicted in your slide. In the left-hand picture, here, you see laser therapy, which can be used to promote healing, among other applications. In the right-hand picture here, you see mechanical traction. This modality is used to decrease spinal pain and help improve motion. In this short video, you will see a demonstration of mechanical spinal traction in combination with core muscle strengthening. These are common treatments for spinal pain.
Back pain is a common problem. At any given time, up to 25% of the population can suffer from lower back pain. Sometimes it is mild and goes away on its own, and other times the pain becomes severe and can limit your mobility and even lead to a form of disability. Physical therapists are movement experts and is one of the areas that we are trained to treat. And one of the therapies I'm going to show you today is spinal decompression traction therapy. It's a safe and effective treatment technique that's non-surgical and no medication needed. It's going to pull for 30 seconds and then relax for 10 seconds, and it's going to decompress and separate the spaces between the spine. So during the off cycle, I'm going to teach Patrick a core stabilization exercise as well. So while it's relaxing now, Patrick, I want you to breathe in through your nose and exhale and pull your belly button down towards your spine. And hold those muscles that are next to the belly button for 10 seconds. And continue to breathe for that 10 seconds. And then relax. And in your next inhale, as you exhale again, do that same exercise. Training the deep core muscles, including the transversus abdominis, have been proven to show a correlation to a decrease in lower back pain. So virtually all of patients that come in, no matter what their cause of the lower back pain is, we're going to teach them a core stabilization exercise. So it's a perfect tool to use in combination with the decompression traction therapy.
The table on this slide lists the physical effects of the various modalities we have discussed. This information is available in your book, and you should pause the presentation here or refer to your book to become very familiar with this information. This information guides treatment decisions and must be committed to memory. As you will recall, I mentioned that there is controversy regarding the delegation of particular interventions to the physical therapist assistant, joint mobilization being a prime example. Here you see the APTA's position statement on procedural interventions exclusively performed by physical therapists. It reads, "Interventions that require immediate and continuous examination and evaluation throughout the intervention are performed exclusively by the physical therapist. Such procedural interventions that are performed exclusively by the physical therapist include, but are not limited to, spinal and peripheral joint mobilization and manipulation, which are components of manual therapy, and selective sharp debridement, which is a component of wound management." In essence, the APTA's position is that joint mobilization and sharp wound debridement are not within the scope of PTA practice. However, to be clear, this is an APTA position statement, not a law. You will find that in some clinics, PTAs are permitted to perform peripheral joint mobilization, for example. The bottom line, look to the state law of the state in which you practice to determine if you should or should not be performing these techniques. So in summary of our discussions on direct interventions, we have reviewed the basic direct interventions used in physical therapy, and we have examined the APTA position statement regarding interventions exclusively performed by the physical therapist.